My name is Kang, and I'm the Minister for Municipal Affairs. It's so nice to see a big crowd and have friends and communities to join us for this very exciting announcement today. I'm delighted to be the MC, and I would like to acknowledge that we're gathered on the traditional territory of the Coast Salish Nations, the Semiahmoo, Katsi, Kwantlen, Kakite, and Tawasin First Nations. I also would like to recognize the people that we have on stage today, Premier Eby, and Mayor Locke, Councillor Ford of Whistler and President of UBCM, as well as Mr. Tatley and MLAs Baines, Begg, Ralston, and Sims and Starchuk. So today we're here to share a very exciting news from the a very exciting investment from the province of BC. And so to open us off, I would like to invite our Premier, David Eby, to give this announcement.
Thanks very much, everybody. It's funny every time. It's funny every time. Wonderful to see everybody this morning. Thank you very much, Minister Kang, for the introduction and for recognizing the territory. Thank you to Mayor Locke and to you, BCM President Ford, for joining us here today. And thank you to the MLAs from Surrey. We're in Minister Harry Baines' constituency, I think, today at a beautiful community centre with kids playing in the background. It reminds me of good times my family has at the pool, too. So it's nice to be here. Thank you to the Newton Resource Centre for welcoming us here today. It's really facilities like this that make communities welcoming and better and more livable for everybody. In a time of global uncertainty, BC's strong economy continues to attract people from around the world. This growth is our strength. It's good news for British Columbia, and these new arrivals make our province stronger. All of them bring skills and contributions we need, including nurses, doctors, healthcare professionals, front of mind for many British Columbians right now, but many different skills across a whole array of needs that we have across our economy. Cities of all sizes are on the front lines of this historic level of growth in our province. Surrey alone has grown 10% since 2016. That's roughly 70,000 more people who need access to recreation centres like this swimming pool, using the city's roads and sidewalks, 70,000 more people who are reliant on the water treatment plant. In other places across the province, like Lake Country, we know their wastewater treatment plant is not keeping up with capacity. I don't think anyone wants to know what happens to wastewater when it's not treated at the plant. In Prince Rupert, another example, just this past month they declared a state of local emergency because 6 different water mains burst. Residents were told to keep a 4-liter container of water at all times for emergency purposes. British Columbians want their communities to be safe, to be sustainable, but also to be fun and welcoming. They want governments working together to build projects that support thriving, livable neighbourhoods for generations to come. And they want us to do it in a way that keeps property taxes increases as low as possible in a time of global inflation for those that already feel squeezed by rising costs. By putting people at the centre of our economic plan, it has resulted in economic growth that allows us to meet all of those goals that British Columbians have. As part of our plan to carefully put BC's surplus to work for people, I'm proud to announce the new Growing Communities Fund. This is a one-time, $1 billion investment to help communities meet the demands of record population growth, aging infrastructure, and support those communities impacted by downturns, for example, in the forestry sector. These grants will be available to all 188 of BC's municipalities and regional districts, which they can use to address their own unique needs. It will help them improve roads, build more affordable housing, build pipes, sewer pipes, water pipes, and deliver better recreation options for families. This fund is important, as many of our current infrastructure programs are oversubscribed. Cities need more resources than have been available. Some will say that we need to respond to the global slowdown that we're anticipating by pulling back, by cutting services, by downloading infrastructure costs to cities and local taxpayers, or privatizing services so that people have to pay out of pocket to access the things that make life fun and enjoyable in our communities. But that would make many of our challenges worse, not better. And it would pass down costs at a time when people can least afford it. There's too much at stake right now. We couldn't afford that kind of short-term thinking before, and we certainly can't afford it now. In fact, decades of choices by previous governments to underinvest in critical infrastructure means we're facing an infrastructure deficit now. Communities don't have the roads, the arenas, the wastewater treatment facilities that we know we need. And so, in response to global economic headwinds and just the general need for more facilities, we'll continue to make the smart investments today that will make communities stronger. I believe that every BC community should be a place where you can build a good life, with access to a decent home, access to childcare facilities, opportunities for recreation and fun, and with roads and public transit that helps you get to work and back home to your family. By continuing to work with people like Mayor Locke, with President Jen Ford from UBCM, we will build a stronger, safer, and more secure future for every British Columbian. Thank you very much.
Thank you so much, Premier Eby. This is certainly a very exciting news. Since becoming the Minister of Municipal Affairs, I had the pleasure of visiting many BC communities, and in just 7 days, I was able to visit 34 different communities in their own region. And I heard repeatedly that they are happy with the support that they receive from government. But each community has their unique challenges, their unique needs, and in growing the community, something was holding them back, and it is the resources that Premier Eby has communicated. Communities across BC are growing at record rates. Many have aging infrastructures or need for new amenities to support their growing population and to make their communities livable, sustainable, and welcoming. This need is universal throughout BC. Infrastructure amenity funds like the Investing in Canada Infrastructure Program were oversubscribed by $3.5 billion. And this made it difficult for all communities in BC to get the funding that they require to support their essential projects. The Union of BC Municipalities have also called for increased support from both the province and the federal government. We've heard you, we're taking action, and we know that communities can't do this alone, and we're going to be working on this together. In one of my visits, I visited Summerland, and Mayor Doug Holmes and Deputy Mayor Aaron Traynor took me to their community center, where there was a pool. And I saw firsthand how vibrant, how well used, and how proud they were of this community center and the pool. But there was a need for growth, and there was a need to improve their infrastructure, and they have a plan. But in order to be able to carry out this plan, they need support and funding and resources from both levels of provincial and federal government. We have heard, and we're taking action. Municipalities are telling us that they want support to create new playgrounds, new parks, trails, sewer, water, roads, sidewalks, increase accessibility. That's why we're working together with local governments. That's why we're providing them with a $1 billion fund to help with these much-needed projects. The Growing Communities Fund is a part of our government's work to use this one-time resources that we have to support British Columbians now and for the long term. We've designed the fund so that local governments can use the grants for projects that their community needs the most, like supporting new affordable housing and childcare facilities, making road improvements, or building recreational centers like the one we are here today. I'm extremely proud we're partners with local governments, and I look forward to our continued relationships and continued collaboration so that we can build an even stronger community through this investment to make life better for people across British Columbia. Next, I would like to introduce the Mayor of Surrey, Brenda Locke. Mayor?
Thank you, Minister Kang. I am always grateful and blessed to be here and to be here on the Coast Salish lands, Semiahmoo, Kwantlen, and Catesy. I want to thank, this is an amazing announcement for Surrey, so I certainly I'm somewhat overwhelmed and very grateful to the government, to Premier Eby and Minister Kang, and all of the Surrey MLAs that I know are supportive of our city every single day. So with gratitude, I thank you all. I am so pleased to be here on behalf of Surrey City Council. This is an exciting announcement for us right here in the heart of Newton. And as you can see, this is a family place, a place for families and children, and a very, very exciting and happy place. If you can hear in the background, there's a classroom of kids just having a great time. This investment by the province is so much needed for our community's infrastructure. As we know, Surrey is the fastest growing city in British Columbia, and we are growing at a breakneck speed. Our innovative, rapidly growing city welcomes 1,200 new residents every single month. Many, many of those are children. We also have the largest school district in the province, not by a little bit, by a lot. So with that growth, we have the opportunity and the responsibility to work together to create livable communities and create a variety of housing options. This investment from the province will ensure the quality of life for Surrey is not only maintained, but improved. From recreational facilities to parks to roads, this investment through the Growing Communities Fund will benefit the residents of Surrey, both now and well into the future. Thank you so very much again to the government. Thank you, Minister Kang, Premier Eby, and all of Surrey's MLAs. This is important to us, it's needed by our city, and we are entirely grateful. Thank you.
Thank you so much, Mayor Locke. And we know as we are growing our communities together, not only do we work with local governments, but we also work with nonprofit organizations that are doing an amazing job to support our citizens here to find a good place, find a good home, and the services that they need. So the next speaker I would like to introduce is Apkar Singh Tatley, the chair of Diversity Community Resources Society. This is a society and organization that helps newcomers and other diverse communities build the life that they want here in BC and Canada. Apkar?
Good morning, everyone. It's interesting being here today, and I was sharing this with MLA Starchuk as well. Like many of you, I've had experience in this very pool that we're standing in today. I came here as a child, and we played, we had memories, and we had experiences here. But it wasn't just this pool. If you look around, there's trails nearby. We would come here as children. There's a hockey arena. My sisters had practices. And it's not just in the past. It's connected to today as well. There's this continuity of experience in this space in Surrey. This morning I just left our shelter site, a physical space that's offering people comfort, warmth, harm reduction, mental health, resources. In addition to that, we have beautiful spaces that people gather, they congregate, seniors will gather. Spaces that are essentially offering opportunity for growth, for fostering community, for fostering experience similar to what these children here are having today, similar to what I had as a youth growing up. Truly becoming the tapestry of our experience as human beings, as citizens of Surrey. So we want to offer that, and I'm so grateful to hear about this announcement today as a citizen of the city of Surrey, that the experiences that I had will continue. They'll continue in newer generations. There'll be people who will have those experiences, tether them together, and then foster that on for generations. Oftentimes when we think of funding for infrastructure and supports, we think of brick and mortar, we think of, I think the Premier mentioned all the pipelines for water treatment and all that stuff that really is important. But what that equates to is the lives, is experiences, is those things that create community. And so I'm really, really happy to hear about that. Looking forward to hearing what this is going to manifest like. So I'd like to thank the government, and I'd like to thank all the MLAs and Premier Eby as well. I'd like to thank Mayor Locke, under whose stewardship I know this is going to definitely, the funding is going to land in an equitable way to ensure that all communities in Surrey are served and will have these experiences. I'd like to also close by offering big gratitude to our local Indigenous First Nations communities. Everything I just talked about, those experiences, the lives that are created through funding like this, that's through the auspices and graciousness of First Nations communities. So I'd like to thank them as well. Thank you.
Thank you, Upkar, for your remarks. And so this concludes today's event. Thank you all for joining us today, and I would like to invite Tim to moderate the Q&As and invite the Premier back to the podium.
Great, thank you. Happy Friday. For those on the phone, make sure to press *1 to get into the queue. For those in the room, we have a microphone at the back, so please line up if you have a question. We'll start with the people in the room here first. We'll do one question, one follow-up. Don't be shy. Feel free to, and then we'll start with, if you could say your name plus what outlet you're with, that'd be great.
Hello, everybody. I'm Ritesh Lakhe from Red FM. Premier, I have two quick questions to ask. One is the 196 billion funding that is there on the table from the federal government in healthcare. Has a sense been made out of what is there up table for the British Columbia as a province? That's question number one. And second question pertains to a local issue of the transition of police in Surrey, which is a concerning issue with regard to the delay that is happening in terms of the consideration by the Public Safety Minister. So what do you have to say about that?
Thanks very much. I'm recently back from Ottawa, where with premiers from across the country, we sat down with the federal government to discuss healthcare in our country for the first time in 2.5 years. So first of all, I wanted to say that is a significant shift. The fact that we're all at the table together talking about healthcare, how we deliver for Canadians and for British Columbians is essential for every person that's looking for a family doctor, that needs care in a hospital, regardless of where you are in the country. And one of the things that really came out from the discussion was how urgent this issue is across the country. Premiers, regardless of their political stripe, regardless of where they live, facing this challenge around healthcare coming out of the pandemic. The positive news out of the meeting with the federal government is that the federal government committed to maintaining funding for the next decade and increasing that funding over the next decade. We were looking at the federal share of healthcare dwindling lower and lower over the next decade to the point that it was just a tiny overall amount of our healthcare budgets, which means that the provinces would have had to pay more and more and take money away from essential things like transportation or education or community centers. So that was a very important commitment by the federal government. In terms of new money that was put on the table, the specifics for British Columbia are that we will be entering into a bilateral discussion with the federal government about how we move forward together. In the coming days, I'll be meeting with my counterparts from across the country to discuss a formal response to the federal government. And for the money that the federal government put on the table, depending on the year, in the first year it amounts to just over $600 million. In the second year, just over $300 million, and then in the third year, somewhere around $500 million in additional healthcare funding, which the federal government has indicated should be prioritized for certain areas that overlap with our interests as well. Addiction and mental health, long-term care, home care for seniors, and so on. So I look forward to working with the federal government and with my counterparts on the sustainability of our healthcare system, which is a little bit about money, but is also about working together to provide a coordinated modern healthcare system across the country, and the federal government has a very important role to play there beyond just financial.
Great.
Oh, and Surrey transition. Where we're at right now, first of all, I'd like to thank Mayor Locke and the staff team at the City of Surrey. They are working closely with the Solicitor General's office, providing information to that office. The province has a very clear responsibility, which is to ensure that policing is safe in Surrey and that in any transition plan that public safety is ensured and there's a plan for policing in the community to deliver those services. We are working as quickly as we can with the city to ensure that we satisfy that provincial responsibility so that we can hand matters back to the city for them to move forward in the direction that they wish. But we are very committed to ensuring that public safety responsibility, and the Solicitor General is working closely with City of Surrey staff to ensure we fulfill our part of this responsibility.
Great, thanks. Next up, we'll have Emily from Global.
Premier, on today's announcement, 188 municipalities, how do you decide how the money gets divvied up? Usually, you know, Burnaby, Surrey, Vancouver, they all have the bigger asks, but yeah, how are you going to spread the money?
So this is not an application-based. Usually, municipalities make applications. They say, "Oh, we'd like to do this, we'd like to do that," and either Union of BC Municipalities or the province says we approve this or that. Instead, we're doing things differently. We're putting a lot of faith into local governments, into regional districts, to know what the priorities are in their communities. And so what we're doing is a formula-based distribution. The formula is based on an adjusted population that recognizes that rural communities with smaller populations have higher costs in delivering. And the growth in the city or regional district between the two census periods of 2016 and 2021. And making sure that the distribution is fair among cities. So it's a combination of the population and the growth in the population. A way to think of this is, you know, our government has been out there saying to municipalities, saying to regional districts, we need you to approve housing, we need you to support the growth that we're seeing by getting more housing approved. This is our way of supporting that growth. If your city needs infrastructure to be able to deliver that housing, like sewer, water treatment plants, community centres, this is the way that that gets done. In smaller communities, sometimes it's just as simple as building a road out to a site that's owned by the city to build some affordable housing, or demolishing an old school that's sitting on land owned by the city that they want to use for housing. So this funding I see as a way for cities to be able to deliver on those commitments that we have around supporting the growth that we're seeing. At the bottom end, the smallest amount that the smallest municipalities or the smallest areas of our province will see is $500,000. So this will be a significant fund for even the smallest communities in the province.
Second question, unrelated. We did a story yesterday on 2 foreign-trained doctors who are working service industry jobs because of high fees that need to be paid.
Sorry, I missed the first part. Who's working the service industry job?
We did a story yesterday on 2 foreign-trained doctors.
Okay.
Right now, they are working service industry jobs because of high fees that need to be paid for certification. So can the government waive fees and expedite the process to get people like them into healthcare?
Yeah, I can't think of anything more frustrating for British Columbians than qualified healthcare professionals that are here in British Columbia that want to work in our healthcare system when we desperately need people, who are on the sidelines because of administrative challenges around getting their credentials recognized or financial barriers that are preventing them from being able to work in our healthcare system. We need all hands on deck in our hospitals, which is why we've worked closely with the College of Physicians and the College of Nurses, in particular, to speed up their assessment processes to make sure that we have qualified people working in our healthcare system, to, on the nursing side, to waive the financial costs of the certification process, to waive the financial costs of any courses that they would need to do to come up to speed to be able to work in our healthcare system, and to shrink the amount of time that they go through that processing. We've done the same thing on the physician side, where we allow internationally trained or experienced physicians now to work under the supervision of a BC doctor to expand the number of patients that BC doctors can support, and to speed up the assessment process of internationally trained physicians. There are specific issues like, on the physician side, the costs of the recertification, as well as there's potential for us to do even more around recognizing credentials faster from certain countries. We're doing that work right now, and the health minister is working on that, because I share the frustration that people have, that you have people with these skills who are ready to go, and they're not in our hospitals or in our communities where we need them.
Great, thanks. We'll now move on to the phone lines and questions on the phone. Again, if you have questions, star 1 is what to press. We'll start with Mira Baines, CBC.
Okay. Thanks, Tim. So this question is for Premier Eby. Is there an accountability mechanism for municipalities in terms of how they spend that money?
Yes, there is. There are two separate accountability mechanisms. One is the Ministry of Municipal Affairs will be working with municipalities to assist them in identifying infrastructure needs that they have. And there will be specific guidelines about what the money can be used for. It's not for operational costs. It's for capital costs, which basically means it's got to be physical things in the community, like a community center, like a sewage treatment plant, like pipes, like preparing a site for affordable housing or for childcare, those kinds of things. The second piece, beyond the letter of expectations and the expectations we have about how the money is to be used, cities and regional districts will have to put the money into a segregated account to make sure that they are accountable to, not really to the province, more to their communities, so that they can see the money that the province has given and that the community knows where that money has gone, so that it's very clear that it doesn't go into a broader community fund and get lost. They can certainly use it to complement other municipal funding, but we want them to be transparent about where the money actually ends up.
Thanks. Mira, do you have a follow-up?
Yeah, this is on a different topic. Today we saw Burnaby Search and Rescue help a woman out of rubble in Turkey. It was very dramatic footage. And I understand other crews in BC are waiting on the feds for deployment. What more is BC doing to help?
Well, I have reached out to Turkey's representative in British Columbia to express condolences and support from the province of BC to the people of Turkey and Syria who have faced this horrific seismic event, this earthquake that has decimated so many areas of those countries, and definitely in areas where people were already struggling. I think for most British Columbians, when we look at that, our hearts go out to these communities, and more than that, we want to help however we can. So we will continue to work with the federal government and to follow the lead of the federal government on this, but I have reached out to Surrey's consul here to express certainly our concern and our interest in providing support.
Great, thanks. Next question, we're going to go to Dirk Meisner, Canadian Press.
Hi, Premier. During this week in the legislature, during question period, the Liberals continue to focus basically the whole week on your government's drug policy, saying it's too focused on decriminalization and giving out free drugs, not enough on treatment and education. I'm wondering if you think that's off base of them, or just the start of a necessary debate we need to have in DC.
Well, I'm actually grateful that the BC Liberals are now saying that the government and the public should increase investments in public mental health and addiction treatment. That's something the NDP government has been working on for many years. It's a shift in position for them, and frankly, a welcome one. They were a government that cut those supports when they were in government. And to have them say, look, this is an emergency. We need to be investing more in treatment. I welcome that. I encourage it. And I'm keen to work with them on that issue. We are currently doing a whole array of treatment initiatives. We spend significantly more on treatment than we do on safe supply, on decriminalization, which is really about keeping people alive so that they can access treatment. And so we're going to continue to make those investments. I look forward to their support for those initiatives. Right now, at St. Paul's Hospital, we're working with Providence Health on a seamless addiction treatment model where people show up in an emergency room with an overdose. They can directly on-site at the hospital go to detox and go to treatment and into supportive housing. These are the kinds of initiatives that I think will be successful in addressing some of the challenges we face. We're going to continue those investments in treatment, and I welcome the BC Liberal support for that kind of approach. We can always do more.
Thanks. Dirk, do you have a follow-up?
Sure. What do you think of Mr. Falcon's proposal to open treatment centers, free treatment when you need it right away?
I've been an advocate for detox and treatment on demand since I worked as a baby lawyer in the downtown east side. I saw my clients have a moment of clarity that they wanted to get into drug treatment. and they couldn't get into drug treatment. So this was when the BC Liberals were in power, because they had to wait to get into detox. We face profound challenges around the trained staff, the social workers, the addictions experts, to open the scale of treatment that we want to open in British Columbia right now. That's why we have a health human resources strategy to train up those workers to be able to do those interventions. We are opening beds for people with serious mental health and addiction issues, beds at the old Riverview site, the Redfish Centre, more than 100 beds there. Opening Foundry sites across the province. We've got 19 open. I think we're going to be at 24 by the end of the year. These are interventions for youth struggling with mental health and addiction issues, because we know that when you get in earlier, when people are younger, you can save them from a life of pain and addiction. So those youth interventions are critically important. We're going to continue to do that work, and I welcome the suggestion that we do more treatment. We certainly believe that as a government. We set up a Ministry of Mental Health and Addiction to focus on exactly this, and I'm very excited that Minister Whiteside has hit the ground running in that ministry, doing the work that we need to do.
Great, thank you. Next question goes to Wolf Deppner with Black Press.
Yeah, hi. Thank you for taking my question. This is for the Premier. You said earlier that the Ministry of Municipal Affairs will be working with the municipalities to identify projects in communities. Who controls which projects get to build where? Who ultimately calls the shots then? How much input will the ministry have, or will municipalities be allowed to sort of lead the way?
This is a different approach from our typical infrastructure grant programs, in that we are placing trust and confidence in local government leaders to know what their communities need. One of the issues that I see is that there's a huge level of urgency around the infrastructure needs in communities across the province. We looked at a grant-based system, and it looked like we would take about a year to stand it up, to receive the applications, to review the applications, to issue the grants, even before the money was deployed. Communities don't have time for that. They need the resources right now. So what we're doing with this fund is, on a formula basis, distributing it. The final say and decision will be made by the local government leaders. The Ministry of Municipal Affairs will provide guidance, suggestions. You asked us for infrastructure funding on this. This would be a great project. Here's how the province can support you in the work that you want to do. But at the end of the day, the decision will be made by the local governments, but it will be made transparently, because that money will be in a segregated account, and they'll be held accountable by their community for how they spend those resources.
Great, thanks. Wolf, do you have a follow-up?
Yes, I do. Today being February 10th, so by my math, municipalities have about 7 weeks to get their ducks in order to identify projects and so on. How much time is that? How sufficient is that time frame?
So our hope is that municipalities will have shovel-ready projects. We believe that most municipalities do. The reason why we believe this is because we have provincial infrastructure grant programs where cities have applied for funding. They have those projects proposed, they have them prepared, they have them costed, they're ready to go because they applied to the province, but we exhausted the fund before their project was able to be funded. And so we believe that cities have these projects ready to go. But our goal for the cities is really to have shovels in the ground on these projects as soon as possible, to deliver for their communities in ways that people in the community can see and feel and touch and know that both the provincial government and the cities and the regional districts are working together to improve life in communities, to respond to the growth that they're seeing, and to recognize that we have this infrastructure deficit that we have to work together to address.
Great. Next question goes to Katie DeRosa, Vancouver Sun.
Hi, Premier. Can you, in the leadership campaign, you did support involuntary treatment for people who overdose repeatedly. Can you clarify now your position on that? And will some of the surplus money that we're sitting on be announced for treatment? And will we see that before, March 31st?
Thanks, Katie. There are two categories of people who need care that I am particularly concerned about, and I've asked Jennifer Whiteside, the minister responsible, to look into. The first is under our existing Mental Health Act, when two physicians make the difficult decision that somebody is either a serious a danger to themselves or to other people in the community, and they decide that they need involuntary hospitalization for a mental health issue, I want those physicians to know that there's a high-quality bed available, that there's a high-quality facility with supports that has dignity and treats people with respect when they make those decisions. We have seen that physicians more and more often, because of a number of reasons, including the toxic drug crisis that we're in, have been making that decision to involuntarily commit people to health care in our province. We need to make sure that we have those beds available, and I don't think that that is the area of particular controversy. We just need to make sure that those beds are available. So the Redfish Centre is part of that, but Minister Whiteside is doing the assessment with health authorities about what additional beds we need for that existing process. There's another group of people that I'm very concerned about. These are folks who overdose once, go into the emergency room, they're resuscitated, and because of the intense cravings related to fentanyl addiction, discharge themselves from the emergency room, go back into the community, get more drugs, and then overdose again and are brought back to the emergency room. I've been told by emergency workers that this can happen 3 times in a single day or more. When I was speaking to the Mayor of Burnaby about this issue, he told me that on one of his shifts as a firefighter before he became mayor, he had somebody overdose 5 times on a shift. It's obvious to me that we need to do things better in terms of responding to people overdosing multiple times in a day. That's part of what our St. Paul's Providence Health work is that we're doing. But it's also about working with Indigenous leadership, people with lived experience, and experts in mental health and addiction to find the interventions that we can do at that moment to break that cycle that aren't going to make things worse. One of the issues that's been raised for me is sometimes when you have involuntary care for someone immediately when they overdose, that they're reluctant to go to hospital. Their friends are reluctant to bring them to the hospital for treatment. And so finding that balance, making sure that we're not doing things that make things worse, because our goal is to reduce the deaths, to keep people alive so that they can get into treatment. But I'm very concerned about that group, and our work will continue in that area, and we'll find a path forward to intervene when someone's involved in a crisis like that. Just for you, Katie, I'll give you a follow-up.
Thank you. I kind of snuck a two-parter in that one. On the Cowichan District Hospital situation has been, quite upsetting for the Indigenous companies there. What will be done with the community benefit agreements going forward for future projects to ensure that it doesn't happen, that Indigenous communities are sort of shut out on projects on their own land, even if they're not unionized?
So there have been some great successes with the community benefits agreements around Indigenous apprenticeships on the site. For example, at the Cowichan Hospital, I'm advised that 20% of the people working on the site are Indigenous. That the unions working on the site have been doing training in the community to help people upgrade their skills so they can do higher paid jobs at the site and benefit from that. But clearly there's an issue. And so with respect to the Cowichan Tribes Corporation, the company, the KDCC, that wanted to work on the site, there was a structural barrier that prevented them from bidding on contracts. We've addressed that structural issue at that project. They can now bid on contracts for that site. But going forward, we have other CBA projects. We need to make sure that we address that issue in those as well. We're doing that work in partnership with Labour, in partnership with First Nations, to make sure that the CBA works as intended, as it is for so many Indigenous apprentices on the sites.
Great, thanks. Our next question goes to Tom Zatarik from Surrey Now Leader.
Thank you. Hello, Premier. Can you please give us at least a ballpark timeline on when Surrey will have a decision from your government on the policing transition?
My understanding is, and I might look to Mayor Locke for confirmation, is that we're expecting final information from the City of Surrey in the coming weeks. And once that information has been confirmed by the Ministry of Solicitor General and that they're satisfied that public safety has been addressed in any plan that Surrey is putting forward, the matter will be remitted to Surrey to proceed as is their ability to do. which is the best direction that they think the City of Surrey should move forward on. I understand. I mean, I know that there is huge urgency on the part of the Mayor, on the part of Council, and the people of Surrey to have resolution of this issue. And we're working hard at the provincial level with City of Surrey staff to clarify the numbers and the plan to make sure that we're discharging our duty and get this back as quickly as possible to Surrey's hands.
Great. Tom, do you have a follow-up?
Yes. So you're not able to narrow it down to something other than coming weeks?
Well, the challenge is that the Solicitor General has a statutory responsibility to ensure public safety in the transition plan. And we're certainly aware of the urgency at the provincial level. And the critical piece is that there is a credible transition plan, that everybody can have confidence that that public safety piece is crossed off. And once we can do that, then we're ready to go. I want to thank again the City of Surrey staff and the Mayor for understanding that we need that information, that we have that responsibility, and for working with our team, the provincial government through the Solicitor General's office so that we can move on.
Great, thanks. And our next and last question goes to Cole Schisler, City News.
Wow, great honor. Hello, Premier. We've been hearing from patients of BC's long COVID clinics that the province is winding down in-person clinics and moving it to just one broad sweeping online clinic. Can you explain why that's happening?
I'm not familiar with the particular plans of health authorities in responding to the clinic needs, the clinical needs of people struggling with long COVID. I know it's the commitment of the health minister and our government to support people struggling with long COVID, along with generally people accessing our healthcare system, whether they're looking for family doctors or emergency urgent care. We remain committed to that. I'm happy to look into that, and I'll ask staff to get you any information about that. I just don't have the information with me.
Cole, do you have a follow-up?
No problem. Appreciate it. And yeah, my follow-up is it's a good one. Any more goodies coming out of the big surplus that'll be announced in the coming weeks or months for British Columbia?
So the focus for our provincial government is around supporting people in the province. Our province is in the fortunate position of being in surplus this year, but because of global headwinds and what economists are telling us to expect around provincial growth next year, that surplus will not be there. And so making sure that we're using the surplus carefully now to support people with rising costs, to keep costs down, and that's been everything from support on BC hydro bills, consistency and reliability and assurance around car insurance rates that we control through our provincial car insurance company, ICBC, around daycare costs, bringing down the cost of childcare, around infrastructure investments like this to take pressure off of property taxes that many municipalities are facing because of inflation already, never mind adding additional infrastructure. What you can expect is we will continue to try to find those opportunities to bring down costs for British Columbians at a time when we know they're facing increased costs, at the same time building up our economy to withstand the global headwinds that we're seeing.
Great, thanks. And that's a wrap for this event.